Hello, welcome back to my YouTube channel where we focus on the basic medical information making a big difference in our lives. Kindly, if you are new here, consider to subscribe, and if you are a returning subscriber, thank you so much for always coming back to watch my videos. My name is Rebecca Morangi and this is the best place to be. Today we are going to remind ourselves on how to use suppositories. Suppositories are a type of medication which are used to relieve internal piles and other related conditions. And what are these piles? Or hemorrhoids. These are the swellings which appear inside and outside of the Pack passage. The swelling of the blood vessels which appear inside or outside of the Pack passage. And what are the symptoms? One is bleeding. This one you can see it when you go for a long call. You can notice this one on a tissue. Another symptom is swellings of the blood vessels. Another symptom is itchiness or pain. And what causes this? What are the causes? One of the causes is straining when you go for a long call. Straining during bowel movement. Another cause is pregnancy. When the fetus is growing, it exerts a lot of pressure on the blood vessels, which causes these blood vessels to swell. And then it can be hereditary. And how can you prevent this? One way of preventing this is through lifestyle changes, by taking a diet full of fiber. Another one is through taking plenty of clean water. Exercise, and that is regular exercise. You reduce the amount of salt and sugar intake. And also those who like taking alcohol, you reduce the amount of alcohol you take. So lifestyle changes helps to manage or to prevent this condition. So if you eat a lot of fruits, a lot of vegetables, drink plenty of water, do regular exercise, and take a diet full of fiber, you'll be able to prevent this condition mostly. And now, how do you administer these suppositories? Here I have one suppository with me. And before you administer it, the first thing you do, actually you wash your hands. Now I have gloves with me. Maybe if you want to administer it by your bare hands, you wash your hands, or you can use the gloves. And then you you clean your Pack passage and dry it with a clean towel. And then bring the suppository and you open the cover to expose the medication. And this is how you open to expose the medication. And this is the suppository with me, although it has broken. Sorry for that. So what you do, you first of all, if it's too soft, you have to cool it or harden it on a tap of cold water, that is running water, so that it gets hard. And then you ensure there is no sharp rim on the tip, maybe which can harm you when you want to insert your suppository. And then you can soften it by warming it in your hands, or moisten it in your hands. After that, you lie on flat on one side, and then you pull up your nails, one of your nails, and then using your hand, you insert this suppository, and this rounded part, the oval part, being at the top. It's the first part to enter inside the back passage, and then you pull to ensure that it goes deeper. After that, you lie down for some time. If it's at night, most of the time we advise the patient to use it at night mostly. Others, they use it twice a day, but if you are using at night, that is the time you are going to sleep, that is when you use it. So you lie down for some time, and then you can try to pass your pole, or you go for your pole movement maybe after some time, after 1 hour or 2 hours. That is the simplest way of applying the suppositories. Some ask, are there side effects? Oh yes, each and every medication has got side effects, but some get these side effects and others don't. But if you get side effects, you get to consult your doctor or your pharmacist. And how do you store your suppositories? Maybe you are supposed to administer them more than 1 day or like 5 days. The temperature should be below 25 degrees. So mostly that is the best temperature to store these suppositories, because if you put it above the room temperature, they will start melting and you'll not be able to insert them. So if you have maybe a question, if you have something which is troubling you, you can be able to visit the nearby facility so that you get to get assisted. Thank you so much for always coming back to watch my videos. And if it's your first time here, don't forget to subscribe. And welcome back, and see you in the next video. Bye bye.